Hello, everyone, and welcome to our 10th edition of Health Inside Out. I'm your host, Colin Haynes. Remember this show? Remember this show has grown out of the need for a health information and a need for information, interaction, and a managed street knowledge about health issues affecting Guyana. This entire show is brought to you by the kind compliments of CAMS TV, which is a community sponsored telecast. Remember, CAMS TV is accepting donations as well. Since we're community based, the operator will place the Zelle and the Cash App accounts in the bottom of the screen. When making donations, you can mention the Health Inside Out show. We talked about the need for comprehensive mental health programs, and so 100% of the funds are going towards a team consisting of public health practitioners, child and adult counselors, and psychologists across all 10 regions of Guyana. There is an avenue for sponsorship. We're lucky to have a segment sponsoring our show today, but feel free to reach out to me as well at +1 443 509 6166, and we can discuss about having segments being sponsored by your entity. Again, all these funds are going directly to our mental health and community outreach. Not forgetting at the end our call-in segment, or you can also feel free to give your comments. We're streaming live on Facebook and YouTube. This actually segment is brought to you by Eureka Medical Labs, which has since blossomed into one of Guyana's premier medical institutions, securing a sizable laboratory market share. Eureka Medical Laboratory now operates out of Georgetown, which is their main office, New Amsterdam, Rosa, Porica, Charity, Anna Regina, Linden, and Bartica. Today, we're going to be talking about medical laboratory professionals, and medical laboratory science. So, according to a book on the best jobs of the 21st century, medical laboratory is also known as a clinical laboratory that performs tests on patient samples to help diagnose, treat, and prevent disease. It encapsulates the science of medical laboratory. It's a science. It's a science where health profession provides diagnostic services, the need to detect and treat disease. Diagnostic services include chemical, hematological, immunological, microscopic, bacteriological, analysis on blood tissues and body fluids. So, what does medical laboratories do? They analyze samples. They detect disease. So you have medical laboratory scientists use their findings to detect diseases like cancer, diabetes, heart attack. That's how we actually know. You have a condition is because a lab test has been run. So this is a science and is directly related to healthcare. They also identify causes. Medical laboratory scientists help identify bacteria and viruses that are prevalent in our society among folks that are infected. They also monitor quality. Medical laboratory scientists, they monitor the quality of the testing. They also consult with other healthcare professionals to help make decisions about patient care. So, medical laboratory scientists, also known as a medical technologist or clinical laboratory science, works to analyze a variety of biological specimens and report these tests to physicians. Medical laboratory scientists perform complex tests on patient samples with equipment such as a microscope. They also use the data, which plays an important role in, like we said, identifying cancer, heart disease, diabetes, and other medical diagnosis or diseases. It is estimated about 60 to 70% of all decisions regarding a patient diagnosis, treatment, and hospital admission and discharge as well are based on the results of tests medical laboratory scientists perform. So, if you want to be a medical laboratory scientist, how do you go about being one? Well, there are several skills that you need to succeed as a medical laboratory scientist. They include communication, detail oriented, manual dexterity with your hands, visual acuity, the ability to see very well, independence, intellectual, creative thinking, and you have to have a passion for what you do. Now, the requirements is in addition to the knowledge, skills, and experience, you need to also acquire a Bachelor of Science in Medical Laboratory Science degree from an accredited academic institution that is usually accredited by the National Accrediting Agencies for Clinical Laboratory Science, NAACLS. Now we're gonna zoom in a little bit more because a lot of our show we're talking directly. How does this affect Guyana? In 2009, the data showed that the country had 13 medical and pathology scientists. So I think this number is probably a little higher now, hopefully. And we also had um, 65 medical and pathology technicians. On January 21st of this year, the Ministry of Health announced 15 newly trained laboratory technicians, bringing this number approximately to about 80. Now, we're going to move into our next segment where we're going to ask our producer to bring in our guests, and we'll talk about our guest today. We have a special guest. His name is Lieutenant Kieran Liverpool, MBA, MLS, and he hails from the mighty village of West Watuka. Uh, and in Linden. So we're both Lindeners. He started his naval career out of Brooklyn, New York in 2007. After 2 years of being a hospital corpsman, he attended the Medical Laboratory Technician School, where he obtained an associate's in 2011. He's been stationed in many different platforms at different duty stations, most notably in Afghanistan as a laboratory technician in 2013, being stationed at the Naval Hospital Guam, where he's worked as the work center supervisor for the lab, simultaneously completing his bachelor's degree in medical laboratory science and becoming a medical laboratory scientist or technologist. His most influential assignment was being an instructor at the Navy Medicine Training Command, Support Command, where he taught and trained many medical laboratory students. It was at this command he also completed his MBA at the University of Texas Tyler, where he commissioned to become a naval laboratory officer. So Lieutenant Liverpool serves currently as the laboratory department head. So let us welcome Mr. our Lieutenant rather Liverpool to our show. Welcome to Health Inside Out. I uh, I don't think I'm hearing you. Are you hearing me?
You hear me now?
Yes, yes, yes. Welcome to the show. How are you doing?
I am good. Thank you for that pleasant introduction.
Thank you so much. So, Lieutenant Liverpool, you say you come from the mighty West Watuka in Linden, as you call in your bio. You also enlisted in the United States Navy as a hospital corpsman, and then you worked your way up to becoming a laboratory scientist. You've got an MBA now. Why a career in medical laboratory science? What has led you to this?
Um, well, Colin, like you, I heard some of your stories. So, like you, I was inspired one semester in high school. I believe it's third form. I got really sick. Right? They didn't know what was happening to me. Um, Multiple trips to the hospital, multiple specialists, multiple doctors, and people could not diagnose me. Um, it even happened that I actually passed out at a doctor's office one time. Um,
Wow.
I I eventually got admitted to the Mackenzie Hospital, and they were able to figure out what was happening to me. And I actually wanted to go into the business stream, but after that experience, I said, you know what? Maybe I can affect the life of somebody like me, right? Maybe I could make a difference. And it was right then and there I changed my choice of stream and entered the science stream. So it all started from that experience.
Oh wow, I've known you for a couple of years. I did not know this story, but Yeah, I think a lot of us in medicine, we are inspired by our personal experiences. You know, mine was I had uncle pass away from HIV, so that has led me to this stream, and so I'm really happy that you've taken that up. Now, it is estimated that 60 to 70% of all decisions regarding a patient diagnosis, treatment, hospital admission, discharge are based on results of the tests of medical laboratory scientists perform. Now, it seems like your job is very, very important. About 60% of a patient's, whole health sits in your hand in terms of what you do. How do you balance this expectation with your skills, experience, and things like your accuracy and so forth when you're performing a test?
Well, it's a huge responsibility, right? That's the first thing you got to think about. Um, that comes with trying as much as possible to be competent and perfecting your try as much to perfect your skills. All right. One of the major practices we do in the lab is quality control.
Mm-hmm.
Quality control tests your analyzers and tests your systems, and it makes sure that everything is working the way it's supposed to work. If your quality control passes, then you're able to test patient samples. If
Mm-hmm.
your quality control fails, you are not allowed to test patient samples, right? Your lab could be shut down if that's a practice of yours. So the biggest thing and my biggest job is to make sure the laboratory is in good standing and we're producing quality and accurate results.
You must be nervous at times, knowing that your work can influence or change the overall outcome of a patient. Now, I heard a story of a friend of mine told me that he got a lab test and they said he had cancer. And actually, what they did was when they were running the samples, for some reason, and this is not in Guyana, by the way, it's right here in the United States, things happen. They actually made a mistake with his name over another patient. And so he called them and asked them to run back the test or, draw the test again. And, he did not cancer. So it seems like your job, it has to be, you have to be very attention to detail because you're dealing with the expectation of a diagnosis. There is medical malpractice. There is also the people, their nervous anxiety, that kind of thing. So are these some of the things you're thinking about when you're running a test?
Um, Absolutely, of course. In some of the labs I've been at, we've had strict no cell phone policies, strict no headphone policies. We tell people like, hey, not because you're not face to face with a patient, that doesn't mean we're not affecting patient care. If you're holding a tube of blood, you have to look at that tube of blood as a patient. And we
Mm-hmm.
try and we tell each other, we tell them like, hey, how would you feel if yourself or your family member, like your friend just got misdiagnosed because of your, lack of attention to detail, right? So
Mm-hmm.
that's you have to implement those type of things, and it's as I said, it's a huge responsibility, and we got to be cognizant of we have a very important job. People's lives are on the line,
Mm-hmm.
right?
Mm-hmm.
I've seen instances with erroneous, incorrect lab tests, and a patient was treated based on those tests, right? So
Mm-hmm.
it's a very serious thing, and it's a very important thing.
So, can you tell us what is a day like for you when you get into work, both on the technician side and the scientific side? What is a normal day? What does a routine day look like in the lab?
Um, well, that depends on the platform, right?
Mm,
If I'm back stateside, I'm in a regular hospital lab. For me, as it is, well, as a technician, you come in, right? First thing you do, you might do some preventative maintenance on your machines, your analyzer, right? Make
Mhm.
sure the lines are flushed, everything is clean, you're good to go, right? Then we'd run, I talked about quality controls. These are like kind of like fake samples, fake patient samples, but you know the results already. So
Mhm.
if the analyzer runs the quality control and it's not what you're expecting, you know
Mhm.
something is wrong with your system, right? So that's the very first thing that you do. Um, you go to the tech, you go to the person that you're relieving. You do a pass down any pertinent information like, hey, the ED has so many patients. Hey, MSW, one of the wards have this many patients. Expect them to be ordering this test thus frequently. Um, on the other side, the admin side, you review those results. If any abnormal results might come across your desk, quality control is always a thing. Inventory levels, you have to review what the techs are doing on a daily basis, just to make sure again things go back to quality. You also communicate with the medical staff, doctors, nurses, address their concerns, things like that.
What are some of the most common tests you or samples that you run on a daily basis in the lab?
The most common ones, the ones you see all the time, are your complete blood count, right? Um, and depending on the season, you have a lot of respiratory samples, and we could go back to the times in COVID when that was like 75% of the things that we saw. That was an
Mhm.
interesting time, and
Wow.
for the on the chemistry side, we see a lot of chemistry tests, as you had mentioned before, like your liver enzymes, kidney enzymes, and yeah, things like that. So mainly a complete blood count, which can tell you if somebody suffered from an infection, or that's how a lot of that's how you could first notice if somebody has cancer or not when you look under the microscope and see what somebody's complete blood count. And respiratory samples, just because it's flu season, all right? And yeah, your
Yeah.
chemistry tests.
So it's like flus, it's like a CBC as they call it,
Yeah, yeah,
a comprehensive blood count, and then
yeah.
there's the chemistries already, which is like a comprehensive metabolic count, right?
Yes, yes.
Okay. So when people have to do these lab tests, these lab tests are looking for certain elements within their bloods, right? So for instance, a CMP or a CBC rather is looking at their white blood cells, red blood cells, that kind of thing.
Absolutely, yes. So
Right.
your CBC are looking at your white and red blood cells, right? The
Hmm.
CMP, the complete metabolic panel, those are
Right.
your chemistries. You could detect, man, you name it. You could detect if somebody is dehydrated,
Hmm.
if their liver enzymes are elevated, they might have something wrong with the liver, kidney functions, things like that.
Yeah, and you can also see, yeah, things like their thyroids and all that stuff from a
Yes,
CMP,
yes.
right? Okay,
Thyroid is a big one. Yep.
thyroid is a big one.
Yeah.
Has there ever been a test that has challenged you the most or continues to challenge you?
uh we could talk about blood bank. The blood bank section of the lab is the one section you can kill somebody really fast,
Oh,
right?
wow.
If you mistype somebody's blood, right, and you give them the wrong blood type, you can instantly kill them. So when you're in the blood bank, that's when it's all tunnel vision. Nothing else matters.
Hmm.
That's all your attention, all the distraction is going to perform it and type in somebody's blood type correctly. So I would say blood bank is, and blood bank is the most challenging.
All right. I think you've, I think, I think you're muted again. Are you?
No, you
Okay,
hear
good.
me?
Yeah, yeah,
Yeah.
yeah. So you said
Did
blood
you?
bank, right?
Yeah,
Okay.
yeah, yeah. You didn't
Um,
hear? You didn't hear what I said?
yeah, I think you heard. I think just at the end, it
Oh,
cut
okay,
off
okay,
very
okay,
shortly.
okay, okay, okay.
Now, when you're running these tests, there probably needs to be some conditions, right? They need to be a certain temperature, a certain number of lab technicians, technologists, equipment. Um, I'm going to give you a story where I served a very short time running a hospital in Guyana, and it was at that time very um, short of staff and short of equipment, even particular when it comes to air conditioning, which I think is big, right? Temperature is big. What are some of the things like what are absolutely necessary the conditions for labs, because you're dealing with specimens and you're dealing with bacteria and these kind of things. What is the ideal temperature, and what about the staff? How much staff you think you need to run different types of labs?
Yeah. Well, let's talk about the conditions, right? Most labs, most specimens, they come in and you run. But first of all, we take temps and humidity every day. If
Mm,
your temperature and humidity is out of ranges, some of your analyzers might not work, or it's unsafe for them to work under those
mm,
conditions, right? So if
mm,
that happens, if AC breakdown, weather, mechanical, whatever, if that happens, the first thing is you got to
mm,
start sending out samples to a different lab. That's why it's important for you to build relationships with other facilities, right?
mm,
um so a lot of labs, they come in, they're coming at room temp, and you run them that way. If you store most of the labs, if you store them in the refrigerator. Was it 2 to 10 degrees Fahrenheit, right?
mm.
Um, and some specimens, if you freeze them, they'll stay longer, right? And it just depends on your operating procedures. It tells you what tests can be stored over how long period of time. Staffing. You're gonna make me pull my hair out, and I don't have any hair, right?
For a long time, you didn't have here.
Yeah. Staffing, that's been an issue for years. Speaking to some of my colleagues in Guyana, it's the same thing, right? There is not only a national shortage, there's a global shortage of laboratorians, right? So
Hmm.
staffing, you do what you can. You
Hmm.
try to motivate the staff as much as possible, and you try to have equal shifts. Um, Automation is a thing that can alleviate some shortages because it helps with burnout, and
Yeah,
it
yeah,
helps with energy. So that's one thing in the states we're transitioning to having more automation.
right. And what about equipment? When people think about a lab, they think about one microscope. Um, what are some of the equipments? What are some of your toys that you use on a daily basis? And we have to compare that as well with less developing laboratories like we have in Guyana. But tell us what are some of these equipments that you're using on a daily basis?
Some of the equipment, yeah, you have your microscope, and I talk about we have, well, in the state we have like big big some of these analyzers cost $1 million, right? Depending on the type of test. So your chemistry analyzer is gonna be the most expensive, right? I've
Mm-hmm.
seen chemistry analyzers run about maybe like 3 million. Okay,
Oh.
because you gotta think some of these analyzers, they perform complex testing. Um, when your blood is spun down, right? It's centrifuge. When your blood is spun down, serum or plasma is left, right? Based on the color of your serum, these analyzers could shine a light through it, and based on the color, it detects the results. The results is transmitted to the computers.
Right.
So it's things like that. Then you have your rapid tests, cards. Like I said, when I was on the operational side, we had these cards. We would take somebody's blood, put them on the cards, and right there, then it could tell you somebody's blood type, right? So things like that.
Um, we're still streaming live via Facebook and YouTube. We have some folks are giving you their best wishes, Kieran. Um, some folks are saying that one of our guests says, "Somebody please tag the Minister of Health. He might learn something here." That was very funny. So yeah, please, guys, please, any questions or concerns you have, please post it in the chat. I will also ask Mr. Liverpool to answer some of those questions or concerns that you have. If you have any questions about the laboratory tests that you've run or something, you have an expert here. So ensure you utilize this time for that. Now, we were talking about equipment and then we were talking about technology. Now, you've known that we've entered into a new spectra of technology with artificial intelligence, or as they call it, AI. Where do you see AI going in terms of medical laboratory?
Oh, it's a thing, and it's been in discussions
Mm-hmm.
because there's a, there there's a positive, right, and then there's a drawback with
Mm-hmm.
AI and automation. The goal is to alleviate human error. When you
Right.
do this, you increase the accuracy of producing accurate tests, right?
Mm-hmm.
Um, but also the concern comes with eliminating jobs.
Mm-hmm.
So that's the fine line we need to balance, and we would advise people, hey, get educated, right? Think outside
Mm-hmm.
the box. Think about ways to increase your value. Learn how to operate AI, because as it stands right now, all right, unless we like become like the Terminator or the Matrix or something, as it stands right now, right, we still know how to operate machines. So it's been a topic of discussion, but we've been advised or recommended we need to be more versatile.
Yeah, because AI will change both uh, how procedures are being done in the lab, so how tests are being run. Maybe you could just set up one person there, just setting up, the analyzers or stuff, and it's gonna run these tests and give you results and send it to the patient's chart.
Yes.
What about patient safety? I mean, that's one of the things about medical integration of AI that keeps me up at night. It bothers me, and sometimes it frightens me as well about patient safety concerns. I know a lot of people think about jobs, and that's a real good concern too. But what about patient safety?
You're talking in terms of using patients like information and
Hmm.
like private information, things like that.
Yeah, yeah. Because, for instance, I was talking to a friend of mine, and he's telling me that they're going to use AI to pull your health information, and it essentially will sort of the goal is to walk around HIPAA a little bit, so you don't need a release and that kind of thing. Which kind of, like I said, there's some concerns there.
I don't. Yeah, I don't like that aspect. If it's gonna come to that, because how many times do we see data leaks on the internet,
Exactly, and
right?
that's exactly
What's I mean, you don't. How would you feel if your health information got leaked on the internet or mine? Right.
right.
That's that aspect I do not like at all.
And what about if there's also like that there's hacks where your results, you have cancer, whatever you have, it's now leaked out,
Yeah.
um, and that kind of thing. So it will be good to see how AI will transform running these tests and producing the results.
Yeah.
I work with two software. You work with one of them, which is Cerner, and I could think about bypassing the process of just you know releasing that, clicking that button, and now it just goes straight there and it goes straight to the patient as well. So that seems like a good thing, right?
Yeah.
With AI. Um,
But as you said, all it would take is a glitch. It could be an innocent glitch in the system,
yeah.
and who knows what chaos could break out,
Hmm.
right?
Yeah. You you've talked about human resource challenges, and this is not only something that is new to you here in the U.S., all over the world, even in Guyana. Like I said, I think now we're somewhere around maybe 25, between 15 to 25 laboratory scientists, and we're somewhere close to 80 to 100 um, in terms of um, in terms of technicians, laboratory technicians. I think certainly that's not enough. But how are you dealing with the human resource personnel issue? Within your scope of practice.
Man, that's that is honestly my biggest challenge, right?
Mhm.
We are currently trying to implement more automation. Okay, we have a system that's called a track, or my last lab we had a track. The track is you would place samples in it, and the track would divvy out the samples to whichever section, right? If ideally, if you only have one tech to cover like four sections, you could just
Mhm.
you place the samples in the track. The track is going to take it to whichever analyzer, and that one
Mhm.
tech could go face on the more challenging or priority test. Um,
Mhm.
a big thing is retention and recruitment, right? We gotta. A lot of people don't know what we do.
Mhm.
We gotta go back to the grassroots level, and
Mhm.
us in the profession, we gotta do a better job at branding. A lot of it comes down to branding. People don't know what we do. People only found out about us during COVID. We got to be hitting these high schools, these
Mhm.
colleges, recruiting, telling these people, because not everybody wants to be a nurse or a doctor, right? Some people like science, they like, chemistry and things like that, but they don't want to be front
Mhm.
facing. And a lot of us, we're like introverted. We like to be in the back and operate in the back. So we got to be better at retention and recruitment. That's how we're plan and right. Money's a thing. Let's be honest. Money's a thing. Let's be honest. Um,
Mhm.
However possible, the powers that be, there needs to be an injection of more resources into things like pay.
Yeah, but I heard that you guys make $1 million a year in a lab.
uh whatever is necessary to keep up with inflation.
Yeah, yeah, it's good. The range, I think, uh globally ranges between 60 to 100,000. I think it probably based on experience and public versus private and all of that. But
Yeah,
it's a good
yeah,
profession to get into.
yeah.
And I think there's also a need for more laboratory in Guyana.
Hmm.
We have Eureka Labs. They're one of the bigger private outside of the public system. And I think there's a few other medical laboratories, system services rather, and then there's the private entities. But I think there's a great need there. Would you want to make a comment on that? Are you going to open up a lab one day in GT?
well, I was just home in November, and somebody was telling me that they're like, "Hey, maybe you should, think about doing stuff because we
I
truly need
agree.
it. We
I
truly need
agree.
it, right?"
Yeah.
Um, it's something, and we've talked about it. Our crew have talked about something like
Yes.
that. So it's something that I'm open to. Hey, it's all about serving the patients, right? Anything that
Yeah,
could increase the value and improve patient care.
I agree. We have a question from one of our viewers, and you probably will know this a little bit more. She's saying, "What will make your blood count drop from 12 to 10?" I'm not sure, but you probably are familiar. But what will make a drop in your blood count? What do you think?
Um, she's probably talking about the hemoglobin level. Um, if you lose blood or Some people might be anemic, right?
Mhm.
That could cause your blood count to drop, your hemoglobin to drop. So your hemoglobin is like the solid part of your blood, right?
Mhm.
So yeah. So usually you see things like trauma or what I just say, trauma or anemic. People being anemic. So yeah.
Okay. And we have Priscina Mackenzie Mickle. She's saying that her brother's also opening up a lab in Guyana, so you're gonna get some competition there. But I think there's enough. There's
Yeah.
enough. There's enough. The need is enough, and I don't think that not necessarily the public
Yeah.
system is both adequate and should be the only way. But I think if you look at like one of the success stories with Eureka Medical Labs, they started, just in Georgetown, smaller laboratory. Now they've grown exponentially. Now they're all over Guyana. They're in Linden, Bartica, New Amsterdam, all over. So that's a good thing, and that's probably something worth to think. And also they expanded their service. They have doctors there and so forth. So they've expanded beyond just a laboratory, but now they're offering medical services.
Nice. Nice.
So that's
The pie is big enough, man. The pie is
yeah. I
big enough.
mean, yeah, we're a rich nation. We have a lot of oil money. What about Persina is asking, what about nutritional deficiencies? Do you see that as something that you're looking at when you look at a sample? People are iron levels. I know that's one. Vitamin A, vitamin B. Talk to us about that.
Um, yeah, we could. So we're not we're not trained to interpret results, right? We provide
Hmm.
results to the doctors, but yes, a lot of us have some experience. Like if you see certain things, you can tell like, hey, this person might not be eating their leafy vegetables. Okay,
Hmm.
um, for us in the lab, most of the labs I've been in, we don't have windows. We're
Hmm.
like in a dungeon on the first floor somewhere. So guess what? Guess what deficiency you see in a lot of us? Vitamin D.
Vitamin
Because
D.
we don't go out and we don't get the sunshine. So if we
Hmm.
see if we test for certain analytes and things like that, you could tell like, hey, somebody's deficient in this vitamin or whatnot.
So I understand in laboratory science, there is a um, there is an anatomical track which deals with anatomy, tests, and then there's a clinical laboratory track. Can you tell us what's the difference between the two?
Okay. All right. So, as you said, the lab is divided into two sections. You have anatomical pathology and clinical pathology.
Hmm.
Anatomical is where your pathologist mainly comes in, and your histotechnicians. I don't know if you guys have histotechnicians in Guyana, but these guys, they cut up tissues, they cut
Hmm.
up tissues from organs and things like that, and the pathologists, they're the ones that they look at these tissues under microscopes and things like that. So anatomicals basically deal with a lot of organs, tissues, and things like that. Where the clinical side is where people like me mostly deal. Um, Chemistries, your
Hmm.
complete blood count, and things like that, and also your urine samples, things like bodily fluids.
Okay. Can you do both of them?
No, I'm trained in the clinical side. Um, your histology technicians and pathologists, they deal with the anatomical side.
What are the requirements between the two? Do you know?
You it's specialized training. You have to go to histotechnology school, or you could become a pathologist, which is a doctorate degree.
Okay, because some people are sitting here thinking that you guys are just like people who are just running tests, and it shouldn't
We
be that
just
difficult.
no. People think we just draw blood,
Yeah,
and
yeah. You guys
nothing.
just
And
drive.
nothing. Listen, it's nothing against my phlebotomists. I love my phlebotomists, right?
Right.
But we
Hmm.
just don't draw blood. That's yes. Before COVID, they're like, hey, the lab tech, yeah, you just dry your blood and that's it. And I
Right.
said, I
Hmm.
love nothing. I love my phlebotomists. Love them.
You're a scientist. Yeah, that's no, that's what your job. That's what your title say. You're a scientist, and so
Yeah.
yeah, and so
I mean, yeah, it's listen. I mean, it's not a big deal to me, but it's just you just got to understand what people's roles are.
mhm. And also, so we talked about the requirements, and you said that you can be both of them. Um, so you're on the public side of things, which is your work with the military. Um, what about have you ever seen, or have you been discussing some of the issues that are facing the clinical and anatomical pathologists or medical technologists in Guyana? Have you been discussing with them?
Um, like I've spoken to some colleagues in Guyana, and like I
Mhm.
said, it's it's just we're going through the same issues, right? Staffing is a big thing, right? Um, they don't get the recognition that they need. There's not Nobody is really advocating for them, and I'm talking about Guyana. This was what was expressed to me,
Right.
right? Um, Pay is of course an issue. Um, there's not. It doesn't seem like there are defined systems to advance, like to move up, right? Those opportunities might be limited. So those are and well for us, we have a lot of resources over here as far as opportunities to move up, but that seems to be an issue in Guyana, as it was told to me. And
Yeah.
then and one of the biggest things too, retention. You can't keep people.
Why are they going? Are they going because they're getting paid more, or they're going because they're going to a
There,
different job?
some people are seeking out other professions.
Mhm.
Some people might, and I know people that have done this. They've worked in the lab and then they've become nurses. They've worked
Mhm.
in the lab and then they've tried to become doctors and yeah, change of professions. So retention is a factor.
Um, do you is there do you deal with biomedical waste? How do you deal with, because you're collecting blood, you're probably not using all the blood samples, or let's say you get a piece of a tissue, you're not using the whole thing. How do you guys deal with biomedical waste? Do you just throw it
Um,
in the trash?
no. So first with we have these things called sharps containers.
Hmm.
Your needles, things that could bore you, stick you, they go in these rigid red containers, right? So those are your sharp containers. For your liquids and stuff like that, we have our biomedical bags, and we take them. So we have a whole department that's dedicated to get rid of waste, and we
Oh,
have contracts with outside companies. They come pick up the waste, and they might put it like in a in incinerator or things
mhm.
like that. So yeah, and that's very important too. That is very important because
Mhm.
if anything, like if one of those samples spill on you or you get a needle stick or something, you got to go right away and address that and have rapid HIV tests and things like that.
Yeah,
So
that's
it's a very important section.
right, right. And I've actually seen where there was a scenario of somebody I know. They were drawing blood from an HIV patient, and they got sick. And so yeah, it's a scary, scary moment. I remember them saying that they went to do rapid tests, and then I think they even put you on some ARVs right away,
They-
right?
yeah, here we have very the meds they put you on, they're very
Mhm.
effective. They are very. I think the effectiveness is
Mhm.
in the 90s percentile. So as soon as you get sick, you go to the ER, you get your
Mhm.
meds, and you do
Mhm.
your rapid tests, and then you're under your section, surveillance. I know you're a big man in surveillance. Then you're
Yes, yes,
under,
yes, yes.
yep, you're under your surveillance for a couple of months just to make sure nothing has changed and
Mhm.
things like that. I don't know. I don't know if Guyana has those type of protocols, but
Right.
yeah,
Yeah, I think they do, because the same protocol you've just highlighted, they walked through the same protocol. When the person got sick, they did the quick test. They went to thing. Yeah, surveillance is important. I think you got to be able to track, to observe what is actually going on with that person. Um, and the best time is right away, right? Because right away you're able to, that right away you can do something. And I'm surprised that the drugs are highly effective as well, because I mean, potentially if you got stick by somebody that have HIV, you're saying you can roll that back right away, essentially, right?
pardon me, I didn't hear that.
You're
What's that?
saying like if you got stick with somebody had HIV and you got stuck, right? You got,
Hmm.
stick, then you can sort of roll that back right away. Sort of, that's what you're saying.
Yeah, yeah, yeah. The meds that they use are very effective, very effective.
Hmm.
Yeah.
Okay. Well, this is good. Now, do you what advice do you have for medical tech professionals? Like, you have a kid right now who's watching this show, who wants to get into the field. What advice do you have for them?
I would say, I would tell them, hey, if you're not, everybody doesn't have to be, and I'm not by no way disparaging doctors and nurses. Everybody, everybody won't be a doctor or a nurse, right? But you can affect patient care the same way. If you like the sciences and you like the chemistries and you like to experiment and you're analytical, things like that, this is the profession for you. If you like to do stuff with your hands, you want to make a difference, then maybe this is the profession for you.
We have a question from somebody I'm sure you know very well. His name is Lyndon Adrian Wilson.
I saw that question.
He wants to
Nice.
know how can he encourage
Nice.
his child to
Yeah.
get interested and not join car house and people. It's a Mackenzie High School thing, because we all went to Mackenzie High School, and
In Linden, Guyana.
in Linden, Guyana. Yeah, we all from Linden. We all went to school together. We went all the way through until fifth form. So he wants a little bit of advice there to get his kid involved. I guess
He could call me
he
offline.
could call you after the show.
Yeah, yeah, yeah.
That is good. Um, you know, this is a good discussion. So in Guyana we are. There is the three M's that apply to when we're analyzing a particular issue, which is manpower, machinery, and money. uh
I like that. I've heard I like that.
you heard the three, right? Okay, now we have money. Now we have a lot of money now. So that's not a problem now. Money is we have the money. Manpower we don't have. We have a shortage of nurses. Um, we don't have the most ideal. We still have a little way to go in terms of number of doctors per 100 per thousand people. And medical technologists now, it's still a relevantly new field in Guyana. What advice you have? Let's say you're not going to advise the minister, or any private hospital. How do we get more folks in this profession? Um, how do we get them?
Um, so I would say, right, we talked about the grassroots of recruiting.
Mm-hmm.
Also, to get more advances, I would highly suggest people
Mm-hmm.
go to certain conferences, right, and build these networking connections.
Mm-hmm.
There's a lot of conferences that take place all over the world, and to be honest, that's how I grew, building my network. Go to conferences, you talk to people that are going through some of the same issues. You'd be surprised what I'm going through right now. Somebody in England might be going through the same thing, but they have a more creative way of managing it, right? Attending these conferences, building these connections, make and you got to make an effort in investing, as you said, in the two other M's, right? Look at what analyzers more advanced countries are using to to produce better results, to cut down on wait times, things like that, right? Um, Also, not forgetting, I would say there needs to be an injection of resources into the biomedical technical field, because these are the guys, when machines and analyzers break, they're more proficient in fixing the issues. So there has to be an injection of resources in that sector of things, because that helps us out too. Hello. Hey guys, Colin asked me. He's having some difficulties, so he asked me to tell everybody thanks for tuning in. I think they ran out of time, and yeah, please join next time. Thanks. All right, bye.